Hi, everyone. I apologize for that. We are having some technical difficulties on our end, but I think we are back up and live. So we will continue the Rock County Public Health Department media briefing. We are streaming live on our Rock County Public Health Department Facebook page again. So we will start where we left off. We already heard our data updates from Nick, so we will go to Seth for some new recommendations. Just go ahead and start from the beginning, Seth. Thanks.
Thank you so much, Jessica. An additional vaccine dose is now recommended for moderately or severely immunocompromised individuals who received the Pfizer or Moderna vaccine series. This is not currently recommended for those who are not immunocompromised or those who received the Johnson & Johnson vaccine. Example of those who should get the additional dose include individuals who have a moderate or severe immunodeficiency and those taking immunosuppressive therapy. For example, individuals under active treatment for malignancies like tumors or blood diseases, transplant or stem cell recipients, individuals with advanced HIV, or those on high-dose corticosteroids would likely qualify as immunocompromised. A more detailed list can be found on the DHS website. Visit www.dhs.wisconsin.gov/COVID-19/vaccine-dose.htm. But for those who are not sure if they are included in one of these categories, a conversation with their healthcare provider is recommended. This is the best way to be certain. The additional dose should be the same product as the initial vaccine series. If that product is not available, the other mRNA vaccine can be given. Nobody should receive more than 3 mRNA COVID-19 vaccine doses. The additional dose should be given at least 28 days after the initial 2-dose mRNA COVID-19 vaccine series. Patients can self-identify as being part of this immunocompromised group in the same way that high-risk individuals did early in the vaccine rollout. But we do want to stress that if anyone is unsure, please talk to your healthcare provider. In addition to the additional dose, immunocompromised individuals should continue to take precautions such as wearing masks, avoiding crowds, and maintaining physical distance from people they do not live with. Additional doses are not the same as booster doses. Additional doses are an extra dose of the vaccine for those who may have not received full coverage from the original series of the vaccine. Boosters help bolster the reduced protection that occurs over time. The goal is to increase an individual's protection that they get from the vaccine. Booster doses are being evaluated on the federal level and are likely to be recommended shortly. Yesterday, the Biden administration encouraged Americans who received the Pfizer and Moderna vaccines to get a booster shot 8 months after receiving their second dose, and the CDC released its own statement confirming this approach. Like before, healthcare workers, nursing home residents, and other older adults would be first in line, likely beginning September 20th, according to the recent comments and CDC release. Before boosters can begin, however, the FDA will need to authorize a third dose, and the CDC will then review that evidence and make final recommendations. The CDC said it also anticipates booster shots will likely be needed for people who received the Johnson & Johnson vaccine. Administration of the J&J vaccine did not begin in the US until March 2021, so they expect to have more data on J&J in the next few weeks. The CDC said its top priority remains staying ahead of the virus and protecting the American people from COVID-19 with safe, effective, and long-lasting vaccines, especially in the context of a constantly changing virus. They also emphasized the urgency of vaccinating the unvaccinated in the US and around the world. Nearly all cases of severe disease, hospitalization, and death continue to occur among those not yet vaccinated at all. We will closely follow this and continue to update you on progress. Back to you, Jessica.
Thank you, Seth. We will now go to Michael for some additional updates.
Thanks, Jessica. So hi, everyone. So we would like to remind everyone that pregnant women are able to get the COVID-19 vaccine, and the vaccine is highly recommended in order to protect their health and the health of their baby. The CDC recommendation is based on new evidence about the safety and effectiveness of the COVID-19 vaccines. Pregnancy increases the risk for severe COVID illness. Pregnant women are being hospitalized at higher rates than the general population and are requiring more critical care, including ventilation and admission to intensive care. Additionally, COVID-19 during pregnancy increases the risk of preterm birth. Getting vaccinated is the best way to prevent these critical complications. Moving now to testing locations. So as we continue to see increases in COVID-19 cases, it's critical that everyone is made aware of the testing options in Rock County. You should get tested for COVID-19 if you develop signs or symptoms of the virus, if you've been in close contact with a confirmed case, or you have taken part in activities that put you at a higher risk, such as traveling or attending large gatherings, particularly in poorly ventilated indoor settings. It's also recommended that both unvaccinated and vaccinated individuals get tested for COVID-19 3 to 5 days after an exposure, even if you don't have symptoms. It's important to note that it is also recommended that you wear a mask indoors in public for 14 days following an exposure or until your test result is negative. If you do test positive, you should isolate for 10 days to prevent the spread of the virus. There are a wide variety of testing options available locally, including pharmacies, at-home test kits, and through local healthcare providers. Currently, free testing is available at Walgreens and CVS with online registration, as well as Beloit Health Systems, Community Health Systems in Beloit, SSM Health, and the UW Whitewater Hyatt Smith Health Clinic. Please visit rockcountyshot.com or contact Wisconsin 211 by dialing 211 to learn more about all the testing options in Rock County. Moving now to upcoming vaccination clinics. We do have some upcoming clinics this weekend and encourage anyone who is not yet vaccinated to please do so as soon as possible. Free COVID vaccinations will be available at the Woodmans in Beloit, located at 1877 South Madison Road, or the Woodmans in Janesville at 2819 Lexington Drive this Saturday, August 21st from 10 a.m. to 4 p.m. These clinics are open to the public, and the vaccine is available for free to anyone aged 12 and up. No appointment is necessary for either clinic, and again, every vaccine is free. Before we wrap up, we want to reiterate that the Rock County Public Health Department recommends that everyone, regardless of vaccination status, wear a mask indoors in public settings. Our recommendation is based on the latest scientific evidence and local circumstances. Vaccination and mask wearing continue to be the best defense against the spread of the virus in our community. COVID-19 case numbers have been steadily increasing in Rock County and Wisconsin due to the increase in prevalence of the Delta variant. The Delta variant is highly infectious and will continue to spread at a quicker pace than previous strains of the virus. Please continue to do your part. Get vaccinated and wear a mask to help prevent the spread of COVID-19. Back to you, Jessica.
Thank you, Michael. Before we turn it over to questions, I do have a couple of additional updates. We have been getting a lot of updates and news very frequently in the last few days. So I just want to share a couple more things that didn't quite make it into the other updates. We will be hosting a COVID-19 question and answer session on Wednesday, August 25th from 4 to 5 p.m. Our main panelist will be Dr. Samaraju. She is a physician from Beloit Health Systems who specializes in infectious diseases. She will be giving a short presentation before taking questions from the public. So this is open to everyone and no registration is needed for this event. We do have a Zoom link available on our website on our coronavirus page for anyone who is interested. You can click that link at the time of the event to join. If you do join via that Zoom link, you will have the opportunity to ask your questions live. The session will also be streamed live on our Facebook page. We will be trying to take any questions that we receive in the comments and passing those along to Dr. Samaraju in that session. And if you're not able to attend on either of those avenues on August 25th, you can also submit your question in advance by sending it via email to covid19.questions@co.rock.wi.us. We'll have the recordings of the event available afterwards on our Facebook page and our YouTube channel. And then I also wanted to pass along some information from the Wisconsin Department of Health Services. They've created a new data page that displays data showing the rate per 100,000 of COVID-19 cases, hospitalizations, and deaths among fully vaccinated individuals versus not fully vaccinated individuals. So by displaying the rates side by side, you can clearly see the difference in the rates between these two groups. Additionally, there are new data tables available to show the rate of COVID-19 outcomes by month for trends over time among fully vaccinated and not fully vaccinated people. No vaccine is 100% effective in preventing infection. So we do expect to see some people who are fully vaccinated that test positive for COVID-19. Fully vaccinated people who do test positive for COVID-19, however, typically report mild or no symptoms. The COVID-19 vaccines are still doing their job by preventing severe illness, hospitalization, and death. And the COVID-19 vaccines remain the best way to protect yourself, your family, and our community from COVID-19 and the highly infectious Delta variant. High vaccination coverage will not only reduce the spread of the virus, but it'll also help us prevent new and possibly more concerning variants from emerging. So that concludes all of our updates. We will turn it over now to the media for questions, and it looks like we have one attendee today. We have Austin Montgomery from the Beloit Daily News. So Austin, will give you the ability to mute and unmute yourself, and you can go ahead and ask any questions that you have.
Thanks, guys. We appreciate you guys doing this, as always. Just wanted to address one of the concerns here. We see kind of a stagnated vaccination rate in Rock County and just more broadly countrywide. Is there any concern that because there is a slow vaccination rate for people who haven't even received one dose of the vaccine, that there will be challenges in getting people to accept the third dose and then possibly a booster? Just wanted to get a response from the health department on that.
That's a great question, Austin. And certainly we are here to answer any questions that people have about the vaccine. So we're hoping by answering those questions, we can make people more comfortable, people who may be a little bit more hesitant to get the vaccine. I believe, and maybe Nick can confirm this for me, but I believe we have been seeing a little bit of an uptick in the vaccinations in Rock County and statewide over the last couple of weeks. Is that correct, Nick?
Yeah, when we looked at the data, kind of when case activity was really ramping up a couple of weeks ago, we were starting to see more people getting that first dose of the vaccine in Rock County. So for a few weeks, kind of in June, maybe at the end of May through June, we were seeing an average of about maybe 500 new people being vaccinated with that first dose each week. And when case activity started ramping up in July and there was the news about the Delta variant, we were seeing about 1,000 people showing up to get the first dose of the vaccine. You know, it's not the kind of increase that we would ideally like to see in terms of new people who are getting vaccinated, but it was a little bit of an increase, and we will continue to monitor this. I'm hoping that as the school year is starting and more people are aware of kind of some of the issues that other parts of the country are facing in terms of people needing to be hospitalized for severe COVID-19 illness, that they will also choose to get vaccinated. And in terms of that third dose being kind of the recommendation and being intended for those who have completed the series and then 8 months has passed since their last vaccine in the series, you know, those individuals are the ones who had the highest level of uptake initially. So, you know, that is some good news in terms of reducing the number of breakthrough cases that we will see in the future. As we have more and more people getting that third dose, there's just going to be less of a risk of breakthrough cases among those who potentially have waning protection because they were vaccinated, you know, over 8 months ago. So that's kind of the situation that we're in right now, and we continue to try to make marginal gains in terms of getting more and more people vaccinated who have not yet been vaccinated.
Thanks, Nick. Just to clarify on that data, was that for Rock County or was that broadly? I don't know if that was regional data or anything like that. And then also too, I had Not sure if the phone had cut out when you were giving kind of your rundown. Can you give that number of cases that were reported in Rock County over the last 2 weeks? Thank you.
Sure, yeah, the data that I shared in terms of the increase in those who are getting that first dose of the vaccine, that was just for Rock County. So we saw the rates go from like 500 people showing up for a first dose per week for a couple months there, and most recently it's been about 1,000 people showing up for a first dose per week in Rock County. And then in terms of the data that I shared earlier, we are averaging about 27 new cases per day over the last week. And compared to 2 weeks ago, it was about 24 to 25. So slight increase there in terms of case activity. And then we're at 418 total active cases right now. And that's about 200 more than it was 2 weeks ago at this time.
Thanks. And then just my last question here. As we kind of go forward here, is there going to be any sort of expanded offerings of the vaccine? I know we have kind of the mobile clinics that are going on right now at various sites in Rock County, but just wanted to see if there was going to be any sort of kind of increase like we saw with health providers, but also there was the site at Black Hawk Tech where we saw vaccinations and testing being offered. Is there going to be kind of a ramp up in kind of that, just the operational and logistical kind of rollout for positioning booster shots and also this third additional one?
I'm so sorry, Austin, I missed part of that question. Could you repeat it?
Yep, sure. I was just wondering, like we saw at the beginning of the pandemic when we had a rollout of places offering testing, and then later in the winter of 2020 when we had a vaccine rollout, just wanted to kind of see if there were any plans for the county to increase offering sites for vaccination outside of the mobile clinics that are already announced, as similar to what we saw at Black Hawk Tech, just as an example.
Thank you. Thank you for repeating that. And thank you for that question. So we're just learning about the booster dose recommendation as everybody else is. And so we are planning, we're in the works. We have some, sorry, not sure where I was going with that. We're working on planning, and we do meet regularly with our vaccine advisory committee, which is comprised of vaccinators from throughout the county. So we will be devising some plans and making sure that we do have the vaccine available to everyone who needs to get that additional dose or that booster dose of the vaccine.
Thanks, Jessica. And just to follow up off of that, I know at the beginning when vaccine rollout had first started, supply was kind of always the big concern. Is that kind of a concern that's going to come to the forefront again as we see people returning to get that booster shot? Just wanted to see what the supply is like right now in the county, if that's something that's able to be commented on today, and if that could be a concern kind of with more demand for people coming back.
Thanks. I have not heard any concerns about the supply. We are at the beginning of the planning for this, so at this point, it seems that our supply is good, and we don't have any concerns that could change. Just like everything else in this pandemic, things change very rapidly. So, so I'd say at this point, we don't have any concerns.
Thank you. I don't have any more questions. Appreciate you guys putting this on again.
Thank you, Austin. Thank you for joining us today. And I want to thank everybody who's been watching the Facebook live stream. I know we haven't been as responsive with the questions and comments today on the live stream, but I promise I will go through and answer all the questions as soon as we complete this briefing. So thank you for joining us. Join us again in 2 weeks, where we will be back on that Thursday at 11 a.m. And have a great 2 weeks. Be healthy and be well.